Let me bring in Dr. Nancy Simpkins, the medical advisor for the state of New Jersey. Doctor, good to see you.
Hey, good morning, Jose.
Good morning. This controversy, this quarantine controversy, of course, began in the Garden State. The CDC put out revised guidelines to try to clarify things, but several other states have unveiled their own protocols. California, for example, the very latest. Should the federal government step in and issue some complete set of rules for all states, you think?
Well, I think it would help the American public greatly if we had a unified front. Unfortunately, that is not the way quarantines work in our country. They are done on a state-by-state basis issued by the Department of Health of each state. But let's talk a little bit, Jose, about quarantines. They have been in effect since the Middle Ages. The word quarantine comes from an Italian word that means 40 days and went way back to the port of Venice when they first started to quarantine people in the Middle Ages. This is not a new concept. This is how we prevent transmittable diseases, and this is what we're doing here by a state-by-state basis.
So do you think that Nurse Hickok is simply acting incorrectly? I mean, after the fact, she is very clearly feels that she is in no danger of getting Ebola, and if she's not having any symptoms, why should she be stuck in her home?
You know what? I think that she's an amazing woman who went to West Africa to treat dying Ebola patients. I do not believe she's doing this for 5 minutes of fame. I believe that she is doing this because she believes that her civil rights are being violated and that she is of no danger to the American public. But having said that, Jose, the American public has 87 to 92% of Americans favor quarantine because of the fear factor. People are very genuinely concerned about this disease. So she was in New Jersey in a tent. She was very uncomfortable, very unhappy. Governor Christie said, okay, we are going to send you back to Maine to your home where you are comfortable with your kitchen, with your bed, with all of your stuff. And it would be a matter of another 10 days and the quarantine would be over. So I really believe that this is excessive now at this point.
And Doctor, stay with me because I want to go on the phone right now with David Hench. He's a reporter for the Portland Press-Herald who's been closely following the very latest developments. David, good morning. This act of defiance by Nurse Hickok seems to significantly raise the stakes in this battle with Maine health officials.
It certainly does, and they're very interested in enforcing their quarantine, and she's very interested in not having it enforced. It does tend to pit the individual against the state.
Yeah, and you know, apparently the state had said that if she did leave her home, she would be arrested. We're seeing her riding her bicycle being followed by jogging reporters. Has the state said anything?
Well, all we know is that they actually had determined they don't have the authority to arrest her at this point. They could go seek a court order that would give them emergency powers to do that, but they would have to prove to a judge by clear and convincing evidence that she poses an immediate threat to the public, and apparently that's a fairly high bar to reach.
And David, tell me a little bit about the local reaction to this.
Well, of course, it's mixed. You know, there's a great deal of admiration for her, and I think among those people who think that government can be pretty heavy-handed sometimes, they respect what she's doing. On the other hand, there's also a lot of fear, whether or not it's based on science or what have you. It's certainly something that's the politicians that are involved have to be aware of. We did have an example of probably an extreme of that, where a woman came back from Dallas, a school teacher came back from Dallas, and her school board sent her home for 21 days because she had been in a city where there had been Ebola. So trying to find the right balance can be a challenge both for scientists and policymakers.
You know, I'm wondering, David, with her attitude, and it's been very clear that she does not feel that she should be quarantined, that she paid her dues, and that she doesn't have Ebola, and she should be free to live her life as she wishes after really sacrificing herself to go over and help folks with Ebola. If she goes out on her bike and nothing happens when the state has said they don't want her to, maybe the next step is to go to a local restaurant or to go on public transportation somewhere. I mean, what are state officials, and you said they need a court order, would they need a court order immediately to keep her from doing anything?
I believe they would. My reading of the law is that you can't just take somebody into custody because you think they pose a threat. You've got to get a judge to agree with that concern. So if that's their concern, that she posed an acute threat, then they have to go through these steps. They apparently haven't done that yet, so she's free to move about. Now, it seems to me that she also represents the kind of person, somebody who would volunteer to go to Africa and work with some of the sickest people in the world isn't likely to be cowed by government and the state trooper telling her she should stay in her house.
Yeah, and Dr. Simpkins, I'm just wondering, it seems it's such a difficult thing to go through because, quite frankly, she has sacrificed so much to help others, and now she is very confident that she is completely healthy. Why should she not be allowed to do what she likes, including riding her bicycle? I mean, it's not like riding your bicycle, you're going to be confronted by hundreds of people.
But, Jose, let's remember now, this is taking so much attention of all of the reporters, of the media, of the medical, of the law. So wouldn't it just be easier for her to comply with the next 10 days and let us all focus on treating Ebola in West Africa, which is what we really all need to focus on? Currently, there is one United States citizen with Ebola, and that is Dr. Spencer in New York City. There are no new cases. So why can't we not just focus where we need to focus, which is in West Africa with sending our supplies, and not worry about what's going on in Maine? That is my objection to all of this.
Yeah, and Dr. Spencer, let's be honest, also thought that he had followed all the protocols and that he did not have the Ebola, and yet later he was indeed found to have Ebola. It doesn't mean that the nurse is going to necessarily have it, but it does take some days to be manifested, right?
That's correct, and it really is 21 days, of which she's well halfway into her quarantine. She's safe, she's happy, and she's in her own home. We are not putting her in a facility that she's uncomfortable in. So as much as I have great respect for her and all that she did, I have to say it's taking far too much attention away from what we should all be paying attention to, which is the resources, the time, the money, the effort to West Africa.
Doctor, thank you so much for being with me this morning. I also want to thank David Hetch for being with me this morning as well. And I want to bring in